Hi everyone, my name is Jaime and I am a registered dental hygienist and proud First Ambassador. Today I would like to talk a little bit about intraoral examinations and early detection of lesions. I am a dog mom of two rescue German Shorthair pointers, Levi and Cece, and I would like to share with you all about my 9-year-old Levi. Back in November, pre-COVID, Levi started smacking his lips and mouth a little bit, which was very strange behavior for him. So the first thing I did, of course, was look at his mouth, his teeth and his gums, and what I found was a pinkish brown plaque buildup, and his breath smelled a little fishy. So being a dental hygienist, the first thing I did was brush his teeth. After brushing his teeth, I decided to wait and watch him for about a week. A week after he started smacking his lips, he started up again. So I took a closer look and this time checked the roof of his mouth also. What I found was a large lesion, red and white, with a bumpy center adjacent to his premolar on his hard palate on the right side. So I put a call in to our vet, Dr. Long, and scheduled an appointment for Levi as soon as possible. At first, we decided to treat the lesion as if it was an injury. So we put Levi on antibiotics for about a week, and I also was using gauze soaked in chlorhexidine to see if it would aid in the healing. Since the area did not heal, Levi went in for a punch biopsy under sedation and some x-rays. The x-rays did not show anything abnormal, so we had to wait for the biopsy results. A few days after Christmas, we got the news that Levi had osteosarcoma of the maxilla, OSA for short. Dr. Long was hopeful that because I caught it early, the prognosis may be better than usual, and the report also showed that his tumor was a grade 1, which is a mild case. The grades are 0, 1 being mild, 2 higher, and 3 higher. Also, it's interesting that oral and maxillofacial OSA represents only 12.4% of canine osteosarcoma, and it may have a better prognosis and lower chance of metastasis than osteosarcoma of the appendicular or other axial skeletal sites. So that was our first part of good news. And of course, as we do, I started researching based on Dr. Long's recommendations. So I went to the website bonecancerdogs.org to find out more information about an osteosarcoma vaccine. The vaccine is a weakened form of the bacteria Listeria monocytogenes and has been modified to target HER-2/NEU, a tumor protein that is common in cancer cells. So this is an immune therapy to help prevent metastasis by killing the cancer cells. So that was kind of exciting news. So I found on the site that Bridge Animal Referral Center of Edmonds, Washington, had the vaccine. And we live about an hour and a half in minimal traffic from Edmonds, so I called them right away to get Levi an appointment. The vet tech told me that the pharmaceutical company that had the trial medication sold it, so the new company could remove the vaccine from the shelf at any time. But if I prepaid for it, then it was technically on hold for Levi. So that was awesome, no problem. They would give me my money back, so I prepaid and it was on hold. So the trials that were done showed that there could be an increased survival rate of maybe about 2 years if used in conjunction with amputation of an appendicular case and chemotherapy. So it seemed like a really good idea, even though we weren't going to go the surgical route. We made the appointment at BARC with Dr. Tripp up in Edmonds and had a few different options for treatment. We decided, after talking with Dr. Tripp, that we needed to go to the veterinary teaching hospital at Washington State University in Pullman for a CT scan and radiation therapy. And meanwhile, Levi started on a metronomic low-dose chemotherapy called satroplatin. It's a 4.4 milligram pill. We get it from a pharmacy in New York. So the pill form of the chemo was a really good option since he couldn't do IV chemotherapy and IV immune therapy at the same time. He also really loves that we hide the pill in a little spoonful of peanut butter every morning for him. And who doesn't like peanut butter, right? So because of early detection, we received more good news after the CT scan, and the tumor had not integrated into the bone yet. So that was really awesome, and Levi only needed just 3 rounds of radiation. The first round was 2 radiation therapies, 6 hours apart. Then 2 weeks later, he went back for his final radiation treatment. After the last round of radiation, he was ready to start his 3 rounds of the vaccine. And we are now a little over halfway through Levi's 1 year of chemotherapy. He's finished with the vaccine, he's finished with his radiation. He has chest x-rays to check for metastasis every 6 weeks, along with the blood work to make sure he doesn't have any complications due to his medications, since he also takes a little bit of carprofen, kind of like an ibuprofen, for potential pain. And so hopefully we have a few extra years with him. So don't forget to check out your pet's mouths to keep them happy and healthy. Hopefully early detection will help get you a few more years also. And now let's go see if we can find Levi. Look, doing pretty good. Hi, bud. And there's CC too. So if you have any more questions about osteosarcoma in canines and our furry friends, please comment below and ask me any questions you may have, or if you have any comments, that would be great, and I will try to share the knowledge that I've learned. Thank you.